The risks and challenges to Africa's vaccination drive persist as 8 countries report 30% rise in cases. This is coming as Senegal joins the likes of Egypt, Morocco and South Africa in the list of African countries that have successfully secured the rights to produce COVID-19 vaccines. Well, joining us right now, Dr. Bassi Okosa is the Director, Disease Control and Immunization, National Primary Healthcare Development Agency. He joins us from our Abuja studios. Thank you for joining us on the program.
Thank you. Good evening, Melissa, and good evening, Nigerians.
Good evening. Tell us, the rollout plan of the National Primary Healthcare Development Agency, how much of the priority population have been covered, bound to receive the full 2 doses of the AstraZeneca vaccine?
Okay. The country plans to reach about 112 million eligible Nigerians over a period of 2 years. And we plan to do this in 4 phases. And these phases is majorly dependent on the vaccine availability. We have what we call the Technical Working Group, chaired by Dr. Faisal Schwab, the Executive Director of the NPHCDA, and where we have all our partners there. Now, narrowing down to the question you asked and how this information is relevant is the fact that for the first phase, remember I've said we target reaching Nigerians over in 4 phases over a period of 2 years. For the very first phase, we have so far received about 3.924 million doses of the COVID-19 vaccines from the COVAX facility and another 100,000 from the government of India. That made it 4.02 million doses that we have received as a country. And for these doses that we have received, bearing in mind the fact that every individual needs to receive 2 doses of the AstraZeneca vaccine to be fully immunized, we divided these vaccines into 2. So we have about 2.012 million Nigerians to be reached with the vaccines. These were the number of Nigerians, living Nigerians we targeted to reach during the phase 1. As at today, permit me to inform you that we are Nigerians that we have reached 97.8% of this target population. And all this we can only thank our President, President Buhari, his vice, the Secretary to the Government, and the Minister of Health, Dr. Hadira, and Dr. Faisal, and all our partners for the support they have given to the team to have this 97.8% achievement till date. And looking at the absolute figure, we are talking about 1,956,318 Nigerians were reached with these vaccines.
Dr. Okosa.
2,012,000. Yes.
All right. If I may, because we also know that some states are also rolling out the second dose as we speak. But the question has also been, at what point should one take the second dose? Is it after 8 weeks, after 12 weeks, or even after 3 weeks?
Okay. I'm looking at the quality we have and the timing and the number, the expiry date of the vaccines. Because we have 2 sets of vaccines. There are some that will be expiring on the 28th of June. There are some on the 9th of July. And a few doses, about 100,000 on the 29th of July. For those that took the first jab early around March, most of them were given 12 weeks. And then moving closer to the expiry date, those that came late for the late jab were given 6 weeks. The manufacturer recommendation is 6 weeks to 12 weeks. So whether you take it by 6 weeks, you take it by 12 weeks, it depends on the date that the health worker had given to you now at the health facility. Because we want all eligible Nigerians who have taken the first jab to take their second jab and be fully protected against the COVID. So between 6 weeks, 8 weeks, 12 weeks, we are all within the range that is recommended for vaccination for a second dose.
Do you think that there are states where some might only get 1 dose, and this is due to the limited supply of vaccines?
Okay. Here we want to thank the chairman of the technical working group, Dr. Faisal, and the entire team, because unlike some of what we've seen in some African countries where they took all the vaccines that was given to them and were concentrating on the first dose, here the team led by Dr. Faisal and the rest member of the team took a decision to give only 50% of the vaccines to eligible population so that the second dose will be available. I will
so essentially,
answer that question
there's enough
vertically
for everyone.
and said that yes, every state will have enough because they only use 50% of the vaccine given to them for first dose, and they are currently on the second dose.
So
as at dates for
Dr.
those who have
Okose,
received the second dose.
just because we
Yes.
need to go in a few seconds, I just wanted to ask now, we heard that we're in bilateral talks with getting more vaccines, because the question is, when are we going to reach the herd immunity needed to protect ourselves against COVID-19? So when indeed can Nigerians, others in the other phases, get access to vaccines?
Now, the president has given all his support, the minister, the secretary of government, the minister of finance, the executive director of finance, everybody is out there to support the team and ensure that additional vaccines come into Nigeria. We are expecting additional vaccines from the COVAX facility. We are expecting additional vaccines from African Union. Here, the government has also entered into a discussion with the African Union where we are expecting about 29.85 million doses that will come in early July. And there are other bilateral discussions with other countries for us to have enough to reach out to the 112 million Nigerians and achieve the herd immunity that you were talking about. So for Nigerians who did not receive the first dose, be reassured that the government is working very hard to ensure that we have additional vaccines to be able to reach all those that are eligible.
We appreciate your time on the program. Thank you. Dr. Bassio Okose is the Director, Disease Control and Immunization, National Primary Healthcare Development Agency. Thank you for joining us on the program.
Thank you, Melissa, and thank you, Nigerians. Over.